ice compression elevation. What's the most important thing I should do after an ankle sprain? Melissa Meiste here from Nephew Physical Therapy to talk about the ever annoying ankle sprain. If you're anything like me and you have a bad ankle, mine is my right, you have sprained it sometimes repeatedly. So much so that one year playing softball, you run to the outfield, step on a ball, roll it completely to the side, and you have no pain or swelling. That's because you've shot all your ligaments. That's not what we're talking about today. We're talking about every time you sprain a joint, and specifically sprain the ankle, there is a recommended protocol, we'll say, that you need to do to take care of that ankle. Rest, ice, compression, elevation. Rest, pretty obvious. Take some weight off that foot. Ice, please ice 10 to 15 minutes. Surround that foot, calm it down, cool down that inflammation. Compression, keep it wrapped, keep it tight. Don't take that shoe off until you can add some extra compression. And elevation, which means above your heart. Sorry friends, laying in the recliner with your foot up on a couple pillows does not count. Elevation is laying on the floor with your foot on the couch, a couple pillows up. However, what's the most important thing I should do? Now we get asked that a lot when it comes to any of the physical therapy exercises that we prescribe or things that we ask our patients and clients to do at home. And yes, all four are important to restore normal motion, normal flexibility, and ultimately normal function. But the most important thing you should do after an immediate and an acute ankle sprain is compression. When you keep that ankle compressed, either with an ACE bandage, a tightly laced up shoe, something like that, it doesn't allow for the skin to stretch. And as soon as that skin stretches, the swelling stays. The swelling, which is a normal body response to the damage we've just done to our foot and ankle, we need that swelling to go down as fast as possible because it's the swelling that makes everything crowded and thus prevents quality range of motion. So keep that in mind the next time you or a family member happens to sprain their ankle. Rest, ice, compression, elevation, but keep it compressed, keep it wrapped. Don't let that swelling pool at your ankle. Again, Melissa Meiste from Nephew Physical Therapy, reminding you pain is not normal. Do something about it.